Live from the Bob Levy Broadcast Center overlooking the Toms River, it's time to get up, get out, do something. Wake up with Jeremy Grunin. Be a part of the show, 732-505-1160. News Talk Radio WOBM AM 1160 and 1310. Listen online at WOBMAM.com.
Hey, welcome back. Wake up with Jeremy Grunin, 7:08 Wednesday, July 13th, 69 degrees, get up to 83 today. WOBM AM 1160 and 1310. News Talk Radio, streaming live on the Radio Pop app and WOBMAM.com. 732-505-1160 to join the conversation. We are now joined by Michael D'Angelo, interventional radiologist at Community Medical Center.
Wow, that was impressive. Good morning. Good morning.
That
was impressive.
All right. So why don't you, so I said interventional radiologist, although that was when I was running out of breath. So why don't you tell everyone, what is an interventional radiologist? What is that all about? Because that's seems like big words for me. Well,
radiology is using imaging, and what we do is we use imaging, real-time X-ray guidance, to do minimally invasive procedures.
That has nothing to do with Pokemon, right?
No.
Okay, good.
Although I see there's people walking around already at 4 a.m. this morning walking around Toms River. Yes, it's crazy,
right? Okay, so that's cool. So you do that, and really kind of what kind of things are you looking for the most part? What do you? Is there a particular discipline that you're called in for, or is it? Or tell me more.
Yeah, you can't really put a finger on. We do a lot of minimally invasive image-guided procedures. If there is a blockage in, say, an artery in the patient's body, we can open that up with a balloon. So if they have a blockage down their leg, we can open that up with a balloon and put in a stent, which is like a metal cage, to keep that vessel open. Conversely, if someone is actively bleeding, say they have a GI bleed and they're bleeding out of their colon, we could stop that bleeding by putting in tiny beads into the vessel to open it up, tiny beads in the vessel to close it down so they don't bleed. And that way it doesn't allow them to have surgery, or they don't have to get open surgery and have something more invasive.
Right, and that's cool. And so when you say minimally invasive, like you're using these tiny little
instruments, wires and catheters, yes. Wow. And we use the arteries, and we do things very, very, our access point is the size of a pencil. And after that, the patient recovers much more quickly.
So how do you decide that you want to get into this? Were you, as a child, particularly good at the game operation? I mean, were you able to pull?
I was all right at it, yeah. And also, it's actually, I grew up in the video game era, so it is like a video game.
Yeah.
In the 80s, I was playing Atari, and it's sort of like that. So you see,
like Adventure or like Pitfall?
I was more of a Pitfall guy.
Oh, were you? Because Adventure, why was the sword bigger than the guy?
Yeah, exactly.
Yeah. All right. So seriously though, how did you decide that you wanted to do this?
Well, my mom is a nurse, and I always wanted to go into medicine, so I kind of knew that off the bat. And then as I was in medical school, I was trying out different things. And in my fourth year, I did a rotation in interventional radiology, and it has all the aspects of surgery, but also has a lot of technology. So that's what made me interested.
Right. So that's cool. So it really does kind of play on your kind of video game end, and it is kind of a cool way to deal.
You'll see a lot of younger doctors coming through right now who are interested in this field. Yeah.
Right. Which is way better than like dealing with feet. Right.
Yeah. I'm not a feet guy.
Yeah. And I always ask the gastro guys how they, and the proctologists, how they get involved in that, like where they decided they wanted to go down that road.
Yeah. I thought about that for a hot second. But
yeah, it was over.
Yes.
All right. So a lot of what you do, you also specialize in chemo, embolization, and of course, radio frequency ablation.
Yes.
So, okay, no idea what that is. What are we talking about
So,
there?
Again, it's the minimally invasive way of treating things, and we do those procedures to treat cancers. So we can, if someone has a cancer in their body, we can treat those things with tiny little catheters and needles to go into the area where there is a cancer and effectively kill that cancer.
Wow. So is that what do you do a lot of that in this area, especially a community?
Yes, we do a lot of it. My colleague, Dr. Gibbons, who I think you met a couple of months ago, he specializes in yttrium-90, where he can actually inject little radioactive beads into areas where there is a cancer, and instead of giving radiation to a whole area, he can give it to a selected area, a smaller area.
Wow.
And focus treatment in that area, which is exciting.
Wow, that is crazy the way medicine has it certainly evolved from when I was a kid, where they would just I think they they hit you with a grapefruit and they hoped it all worked out. You know what I mean? It was different. So when we talk about cancer, cancer of course is the leading lung cancer is the leading cause of cancer deaths. And according to the American Cancer Society, there are more than 224,000 Americans diagnosed with lung cancer each year. So why don't you give us some of the information, kind of who gets lung cancer, who's kind of most at risk?
Well, then I think everybody who's listening right now and everybody knows that smoking is the number one risk for lung cancer. And as good as we are at treating cancers right now, with prostate cancer, colorectal cancer, breast cancer, lung cancer is still the number one cause of cancer-related deaths in the United States, and we want to change that, and that's what I'm here to talk about today.
Right. Does that amaze you when you see people still smoking? I mean, with all the information we have, that they're still lighting up a cigarette?
As I was walking into this office this morning, I saw people lighting up on the street, which is, it still is amazing. And they were younger people, too.
Right.
Yeah.
And it's like they just don't, I guess they just don't care?
I guess they don't care, or, they started when they were younger and they can't quit now. I could see when people were in the 50s and 60s. I know that in the Army they were giving away cigarettes to all our servicemen. That's all changed, but now it is amazing to me still. Yes,
right, because non-smokers. First of all, have a 20 to 30% greater chance of developing lung cancer if they're exposed to secondhand smoke.
Correct.
Right. And 80 to 90% of lung cancer deaths are caused theoretically by smoking.
Yes,
which is unbelievable.
Yes, it is.
What's your opinion? And I don't know if you have one, but I'm taking a shot here.
Okay.
What's your gut feeling on the whole e-cig thing? Or do you have any? I mean, what
you're inhaling something, right?
Yeah, right.
I mean, and there are more chemical. There are as many, if not more, chemicals in that. We don't know. I don't know how well regulated it is, but I don't think it's going to be good for you. And it's going to, we're going to see 5, 10 years down the line, and maybe even worse than actually smoking a cigarette.
Right.
Yeah.
We can't be 100% sure because there just isn't enough data at this point. But to your point, if you're inhaling something like that, it can't be good.
And it's going into the lungs, and that's very friable tissue, so it's going to be affecting it somehow. Absolutely.
Right. So how do people know? What do the symptoms of lung cancer look like?
So if you have a cough that is not going away, if you are coughing up blood, which is what we call hemoptysis, if you are getting more and more short of breath, either with exertion or just by sitting there, then it's something you should definitely be thinking about. Now, that's not to say you will have lung cancer, but it's definitely something to think about. And the thing about lung cancer is that by the time those symptoms present in a patient, it may often be a later stage cancer. That's why I'm here to talk about low-dose CT screening.
Okay, so on that note, low-dose CT screening. So we're gonna get back to that. Actually, we could talk about that in 1 second. But I did you say that if you're coughing up blood, you should probably see a doctor?
I think yeah.
I mean, that's I'm pretty sure that's a safe bet, right?
You would be surprised. I have patients
Really?
that come in. Sometimes they've been coughing up blood for months, and then finally come to see a doctor, and we'll see something that's fairly sizable.
Oof. All right. So when we come back, I want to talk about. Say it again. What is that?
Low dose CT screening for
right.
lung
Of course.
cancer. Yes.
Low dose CT screening for cancer. We're going to talk about that when we get back. We're also going to talk about some of the other risk factors. We are here with Dr. Michael D'Angelo, interventional radiologist, Community Medical Center. Back after this.
Everything you need to know about the Jersey Shore. This is Wake Up with Jeremy Grunin. News Talk Radio, WOBM AM 1160 and 1310. Connect with Jeremy, 732-505-1160. Wake Up with Jeremy Grunin. News Talk Radio, WOBM AM 1160, 1310, and WOBMAM.com.
Hey, welcome back. Wake Up with Jeremy Grunin. We are here with, I have to turn the page, just bear with me. We're here with Dr. Michael D'Angelo. He's an interventional radiologist at Community Medical Center. We are talking specifically about lung cancer. So you kind of talked to us before we were heading into the break about how lung cancer is diagnosed. Why don't you tell us more about that?
Well, the best way to diagnose it is with a CAT scan. And if you are between the ages of 55 and 77, and you have a significant smoking history, which is a 30-pack year history, which means that you've smoked 1 pack a day for 30 years, or that also means you can smoke, if you have smoked 2 packs a day for 15 years, then you are in a high-risk classification. Therefore, you can get a low-dose CT scan of your chest, and we can look for signs of early cancer or lung nodules.
Wow. By the way, you're also broke if you've been smoking 2 packs a day for 50 guys.
I guess so. It gets pretty expensive, huh?
That's crazy. That's like 15. Aside from the fact that you're killing yourself, that's like $15 a day on cigarettes.
Yeah.
Right. I mean, not, I'm just saying that's $6,000 of your income that goes bye-bye. Anyway,
right.
Moving right along. All right. So now you get this low dose CD screen, right? And so what do you find? Like what is it that you see in that screening? What's the sign? What's the thing that hits the bell and makes you say, okay, we got to do something here?
Well, we're looking for lung nodules.
Okay.
And some nodules are benign. They're just there. They're either there from infection or you've had them for a long time. But we still want to follow them. So we'd follow them either every 6 months or every year. But if there is a nodule which is greater than 8 millimeters, then there's something we probably need to do about it. We could either get a PET scan, which is where they inject a radiotracer into your vein, and then this radiotracer goes to areas that are suspicious for cancer, so it can kind of tell us whether or not it's a cancer, or we could do a biopsy.
Okay. And so one of them is called a Viren biopsy?
Yes.
What is that all about?
So this is a technology. It's fantastic, innovative technology that we now have at Community Medical Center. We've had it since December. And in that time, we have already done more cases at Community Medical Center than any other institution in the country.
Wow.
And what it is, it's a GPS for the body. So basically, you get a CAT scan. We take that data. We transfer it to the Viren navigation system. And we could, sort of like the GPS in your car, we can use a small needle to get to these areas that are suspicious for cancer, areas that were previously too small or too difficult to get to with conventional biopsy, and we can get you a diagnosis earlier, which means earlier access to treatment and hopefully better outcomes.
Wow. That's awesome. And so why have we done more? Is it because the doctors believe in it? Is it because it's something or is it because we have so much need for it? Or is it a combination of both?
I think it's a combination of both, but we definitely have a need for it in this area, absolutely.
Wow, that's it. That is amazing. So surveillance versus biopsy, what's the difference?
Well, we look at the quality or the characteristics of the nodule. If the nodule has more of a ground glass appearance, which is it's not really solid, then we may just follow it every 6 to 10 months or to 12 months. However, if it looks solid and it's greater than 8 millimeters, then it's something we have to do something about.
Gotcha. So you and I have a lot in common then, because we both kind of interview folks, right? Like you're interviewing nodules,
yes, right,
to see if you should just watch them or if you got to do something about them. I talk to people.
Your job is way more interesting, but I do enjoy it, absolutely.
Okay, cool. And so tumor board, what's that all about?
So if you do have a nodule that we think is suspicious for cancer, that we may want to get, like I said, a PET scan or do a biopsy, we will present your case at a multidisciplinary tumor board where there are medical oncologists, where there are radiation oncologists, where there are surgeons, and everybody will discuss your case.
Okay, cool. So when we come back, I want to talk about the kind of the myriad of cancer navigators at Community Medical Center, because it kind of runs the gamut there. So, and then we're going to also hand you your magic wand, which I know you're excited to be able to use, right?
Absolutely.
Wake Up with Jeremy Grunin, Dr. Michael D'Angelo from Community Medical Center, interventional radiologist. Wake Up with Jeremy Grunin. Listen to the Hometown View with Kevin Williams, and then the news, and then we'll be back after this.
Live from Town Square Towers at the heart of the Jersey Shore. Wake Up with Jeremy Grunin. Get up, get out, do something. Join the conversation. 732-505-1160. News Talk Radio WOBM AM 1160 and 1310. Listen online at WOBMAM.com.
Hey, welcome back. 7:31, Wednesday, July 13th, 69 degrees, got up to 83 today. WOBM AM 1160 and 1310. News Talk Radio, streaming live on the Radio Pup app and at WOBMAM.com. 732-505-1160 to join the conversation. We were talking with Michael D'Angelo. He is Dr. Michael D'Angelo, of course. I'm sorry, I hate when that's
quite
He's interventional. We were talking youth sports in the break, so I forgot that he's a doctor because we were just dads. We were talking interventional radiology at Community Medical Center. And we were specifically about to kind of dive into the plethora. Oh, yes, El Guapo. I would say you have a plethora. The plethora of different...
Three amigos. Very good reference.
Thank you. The plethora of cancer navigators at Community Medical Center. So why don't you go through what we have going on there?
Well, if anybody has a cancer diagnosis, obviously there's some confusion. You don't know how to navigate the system, and we have excellent nurses who are trained in this realm. We especially have a nurse named Terry Martin, she's wonderful. She's had 20 years of experience, and she'll help you navigate through this diagnosis, get you set up for tests, get you set up for appropriate appointments, and help you navigate which could be a very difficult situation, make it a lot easier for you.
Right. And so there's different navigators, just so we're clear. She is the clinical navigator, right?
She is the lung cancer navigator, but we have other navigators throughout the system for different types of cancers.
Right. So there are different kind of navigators, and then you have actually a navigator program through the American Cancer Society,
correct,
which kind of navigates you through kind of some of the softer skill stuff, which is, wigs, which is Reiki, which is, kind of a lot of the support for recovery and kind of dealing.
Absolutely. Helping with your nutrition, all those types of things.
So really it's an unbelievable kind of group that's put together at Community Medical Center to kind of help deal with such a horrible disease.
It is. It's a group effort, and that's what helps the patient out the best, I think. Yeah, absolutely.
Right. Absolutely. So can tell me a little bit about radio frequency ablation of the liver. Because I'm not going to lie, I just wanted to be able to say it on the air because somebody dared me. They said, you'll never get to say radio frequency ablation.
And you got it in. Look at you.
I said, no, I'm going to say it. So tell me about that.
It's not, radio frequency ablation is where it's a procedure that we do. It's another minimally invasive procedure that we do in interventional radiology. So if there is a cancer, we can put in a very small needle that has tines on it that covers the circumference of the cancer. And then you hook it up to a generator and actually ablates the tumor, thereby killing the tissue. And we also have another technology at Community Medical Center called cryoablation, which I just performed one on Friday. This patient had a kidney cancer and was not a great candidate for surgery. So we were able to put these little needles into the patient, tiny needles the size of a pencil, even smaller, and actually freeze the tumor, thereby killing it.
Very cool. So, You know what I'm thinking about? Have you ever seen the movie Osmosis Jones?
It's a cartoon, right? Wasn't it Chris Rock?
Yeah. Like it's like this. It's like he goes into it's like somewhere between that and Inner Space, right? Like it's like that's what I
Martin
picture.
Short. Yeah.
That's what I picture you doing. It's like there's this whole thing where you're like inside somebody, like putting these little like weapons that you have.
Absolutely.
It's actually
a fantastic voyage.
Yeah, that is.
Another
I got it. That was really good. Come along and ride on it. Anyway, so all right, moving right along. All right, Dr. D'Angelo, it's that time where we hand you the magic wand, the pixie dust, the fairy dust, the ability just to wiggle your nose and make an impact. So if we hand that to you and we say, "What are you doing to make an impact on the world?" What are you doing with it?
Well, I'll stick in the realm of medicine. This is sort of in the realm of medicine, but I would try to reform malpractice. I would tort reform. I think that's a big issue that not many people talk about. We often have it's a very expensive endeavor. If someone if with malpractice, it causes a lot of expenses in the world of medicine. I see a lot of doctors actually practicing defensively because of the potential of a lawsuit, and it raises expenses. There's also often tests which are unnecessary, and I think we could practice and focus down and be have a better approach to medicine if we were be able to just reform malpractice. And I hate to bring it to a real world example of something that's completely out of the realm of medicine, but that is the equivalent of what we're seeing with our police right now. Right, where everyone's everyone's got a camera. Everyone is, every move that you make is questioned and second guessed. And oftentimes, I'm sure with what you deal with, just like with what our police deal with, you're making decisions that you have to make. You have a whole board that makes what you believe is the best decision in the best interest of that patient to preserve their health or restore their health. And there's no way that you're going to be 100% right 100% of the time, right? You can only deal with what you have in front of you, and the second guessing is, it's crippling. Yes. It does. It makes you think, and absolutely, just like in your police reference, everybody's watching.
Right.
Yeah.
Right. It's super difficult. So, where do folks go if they want to hear more about the lung cancer screening programs? What do you have going on? Anything going on where folks can really kind of, if you've kind of piqued their interest in saying, maybe I should go get checked, especially if they're over 55, like you were talking about. Where would they go? What could they do? How could they learn more?
Well, if you are between the age of 55 and 77, then you are and you have a 30-pack year smoking history, or if you know of someone, a loved one or a friend who fits that criteria, I would give our clinical lung navigator, Terry Martin, a call at 732-557-8295.
Cool. And you also, if you want to get referral to a physician, or more information about Community Medical Center, you can always call 1-888-725-7123 or visit barnabashealth.org/community. And most importantly,
yes.
we can't just let this go.
Yes.
Dr. D'Angelo, you mentioned that you have your oldest is 11 years old,
yes,
right? Your 11-year-old son.
Yes.
Now, I'm going to give, look, I'm not a big believer in inside information.
Okay.
Right? Like, especially as it pertains to stocks.
Okay. I'm right there with you.
But we're gonna help our listeners out a little bit. You mentioned that as a result of this whole Pokemon thing, your son's been bugging you about something. What does he want?
Yes, he wants a cell phone so he can walk around town and find all these Pokemon.
Right. So I'm thinking, right, that if you're looking for what the residual growth opportunities are here, I think this is going to be a boom for the cell phone industry.
Absolutely.
Right, as 10, 9, 8, 11-year-olds everywhere start pulling on mom and dad's shirts saying, okay, now I want a cell phone because I don't have cellular data and I can't go find Pikachu at Uncle Dude's Donuts.
That's right,
right
outside here. Yes, there are kids out here this morning walking around.
It's unbelievable.
They have to keep their eyes on their phone and also on the traffic around them.
That's multitasking at its best.
Yes, absolutely.
Right? Well, these are you know what? Today's Pokemon players are tomorrow's interventional radiologists, right? On that note, Dr. Michael D'Angelo, interventional radiologist, Community Medical Center, thank you so much for spending some time with us this morning.
Thank you for having me. Appreciate it.
We'll be back with more Wake Up with Jeremy Grunin right after this.